Hello, we are SNP Out Cancer. In this video, my team and I will be discussing the genetic basis for breast cancer. Breast cancer is a cancer that forms in either one or both breasts. While it is very common in women, it's rare in men. Mutations in genes that increase breast cancer risks are rare but significant, which we will go over later in this video. Some symptoms include discharge from the nipple and lumps found along the breast. Those who have breast cancer undergo treatments such as surgery, chemotherapy, which uses chemical substances, or surgery. Breast cancer develops in the epithelial cells that lines the breast and internal organs. Breast cancer is one of the most commonly found cancers in the epithelial. This is because cells are reproducing or dividing more in the breast. It can also develop in the glandular tissue, which carries milk to the nipple. Breast cancer most often first affects cells in the milk-producing ducts. The genetic causes of breast cancer that were found occurs more often in women and diagnosed more in Caucasian women and those over the age of 55. One has a higher risk of being diagnosed, especially if a relative has been diagnosed with breast or ovarian cancer. Some environmental causes of breast cancer include having a poor diet and lack of attention to nutrition, lack of exercise, and frequently drinking alcohol.
There are 25 different genes that can contain mutations for breast cancer. We believe BRCA1 and BRCA2 are the best SNPs to predict the risk of breast cancer because it poses a higher risk. If you're a carrier of the mutation for BRCA1, your risk of breast cancer increases between 80 to 90% of your lifetime. You also have an increased risk for bilateral breast cancer. This SNP affects the tumor suppressor gene. This gene is expressed in the breast cell. It produces a protein that contains and suppresses the creation of tumors. It makes sense that the variations impact your genetic risk because a tumor could form in the breast if the gene is mutated.
What are the benefits of our test? The SNP chip design allows our team of geneticists to determine whether the patient has a healthy allele or a diseased allele. For example, when looking at the BRCA1 gene, since the allele RS1799950GG is associated with a greater risk for breast cancer, it would hybridize to the spot on the chip designated for the diseased allele and could indicate predisposition to breast cancer. The BRCA1 gene would be the best candidate for our SNP chip test. One study has shown that on average, women with mutated BRCA1 genes have a 72% risk of developing breast cancer by the age of 80.
There are limitations to the SNP chip test, however. Prior knowledge of the possibility of having the disease trait is necessary before being tested. Also, there are different variations of genes that can affect their interpretation on a SNP chip. There are two disease variations for BRCA1. For the RS1799950 SNP, the AG genotype has a slightly increased risk of breast cancer, while the GG genotype has a greater risk. Emotionally, dealing with a disease can be very harsh financially and emotionally. Without proper insurance, and sometimes even with paying for the proper medical care, can be really difficult. It can cause an immense amount of stress on the family. Emotionally, it can be difficult to know that you have a life-threatening disease on yourself and your family, and it can be a difficult process to plan for life ahead, taking the disease into account and its respective repercussions.